So let's start. Thanks everyone. Good morning. Thanks for coming. Jan, who is an associate professor at Southwestern University of Finance and Economics. And today he will present his work on the impact of an early childhood development program on the community with a focus on China. So as usual, we have 1 hour. There are going to be questions during the presentation. And please, people online, just raise your virtual hand. And people in the room, just ask questions whenever you want. Thanks a lot for being here. And the floor is yours.
Thanks, everyone. I'm very honored to be here. Please interrupt me if you have any questions. So let me first motivate. So large number of children are at risk of delay in low and middle income countries. So why at this age of time we care about that? I think to me, like first of all, like we care about their own welfare. The other thing is that this is something I want to do, but like I haven't found an opportunity to do, is to see whether this kind of early childhood development services or like anything improvement on that will help the overall economy to be more healthy and more innovative. So if you have any ideas, come talk to me like after this talk, please. So, and also there is a little bit income gradient on this. You will find a low and middle income country have much more delayed children, many more delayed children in terms of cognitive delay, language development, social emotional development, and even motor development.
Sorry, here, what exactly is the percentage of children developmentally or not defined here?
So usually it's like defined as by 1 standard deviation below the healthy mean. But like I think depends on what kind of instrument or like survey instrument you use to measure a delay.
Yeah, and no, that's why exactly I'm just asking what figure 1, like you say, for the weighted averages to show what's the indicator that's been used here?
So you mean the exact instrument to measure delay?
Exactly.
Okay.
What are you measuring?
So I think it depends. So this is a meta study. So basically it collects data from multiple studies, and in each study the measurement can be different. But like I think a few common ones, Denver 2 and Bailey scale and Crady, like basically there are many measurements. I think Bailey is one of the golden standard. Denver is also very commonly used. So yeah. So another thing, I checked a few papers in the morning about what's the situation in Malaysia. Like I only saw 2 papers. Like because I didn't spend too much time. You probably know this better than me. I think one paper is saying that 37% of children have cognitive delay, and another one is saying 31. It's about like middle income country level, or like yeah. So among those like delayed children, many of them are from rural China. This is an invisible side of the China. Like people usually, when speaking about China, like nowadays, it's like those industrial policy, electrical car, urbanized city. But like there is another side of China that is not very well known. It's like rural China, although it's being talked about a lot by the Chinese government, but like not so much improvement over the years. Like there's some improvement, but like not enough. So there are developmental delays among children aged from 0 to 3 in developing side of China, and only minority of the rural caregiver engage in stimulating parenting practice. They also lack of sufficient knowledge and resources to provide positive parenting practice and child development. The picture, although it's from internet, this is very similar to what I have seen like in the field. Like in many cases, it's like rural caregiver, usually grandma, like strap the baby on their back so that they can do some housework, farming, but during that process, they are not interact with baby. Nowadays, I think it's about, in a project I'm doing right now, it's about like 50% of children being cared by moms, and another 50% either by grandmother-in-law, or grandma from mom's side or grandma from the father's side. So go ahead. Uh-huh. So it's not medically diagnosed. It's rather by a screening tool developed by public health professionals.
I'm not sure what kind of features in China you want to measure, but let's say, for instance, thinking about height for age set scores, yeah, of childhood malnutrition. China, if you look at its figures, China has less than 3% of children under 5 are malnourished. Compare that to parts of South and Southeast Asia, China is incredibly better, right? So I'm just trying to understand what's the notion of exactly like what's the notion of developmental delay? Are we really trying to measure, right?
So I have a few numbers in the following, but I think in the data I have about maybe 5 to 10 years ago, it's about like 40% to 45% of cognitive delay. Although, like at the same, the nutritional data collected around the same time is also what you just said. Like it improved a lot in terms of their health condition, but like their actual development, psychosocial development status is concerned. Yeah. So from the literature, those are from the field. Like from the literature, we know that early childhood environment has a long-term impact on the child later schooling and employment outcomes. So in the literature also shows there are effective intervention that can be provided to those like communities or like households that helps. And also the interaction, like when those like intervention takes place in the community, or even like say delivered by community agents, it's very salient to all the community members. So there could be interactions taking place outside the home, like in the community. It can be, say, children seeing other kids playing, or caregiver talking to each other. So those interactions could lead to those program effects spill over to other households in the community. But like it's less being focused in the literature, trying to evaluate what kind of impact this kind of intervention could have on those other households in the community. So when we evaluate a project, we usually have a group of targeted households, and then that's where or who we are conducting our impact evaluation with. But like the later cohort or someone like in the community, we other than those people, sometimes we don't pay attention to. So in this study, I'm trying to answer 2 questions. So whether an early childhood development intervention could have impact on other households in the community. I will define other household later. And then how does the early childhood intervention have impact? If there are, like how does it play a role? Go ahead. Sure. Developed countries.
Yeah, developed countries. And how do we think about it? Is it similar in the context that you're looking at? Like, I'm just trying to get a sense of how important this early childhood environment is for this context.
So this is something I also are very I'm very curious about. Like, so say those studies, like especially Heckman study, is being done in the United States, and then they track them for 20 years after the intervention, and then they found out this impact. One caveat of many of those studies is that those are efficacy trials, focusing on very small group of people, household, so that in that way, they found out the result, they found impact, and also they focus on extremely poor developed children in the beginning. So, but like this kind of data is somewhat not available in the developing country at the moment. So we don't know yet, but like I think there are efforts being made. Like at least I know a few Chinese studies trying to follow those children, but like those children are about like 10, 11, 12 years old. We will know like in 10 years or so. Another thing, as I mentioned, like maybe with good administrative data, we could try to evaluate whether these kind of services could have long-term impact on the society, besides all those like people who benefited from the program. So besides we change the ranking of the children, like in their cohort. Like if we improve those like disadvantaged children, like if it is just improve the ranking, then the other group of previously advantaged children will be harmed by the program, right? So what I'm very interested in is to see whether there's a program that makes the cake bigger instead of just changing the distribution of the cake. So go ahead.
Sorry. So on the household impacts, who are the, I guess, the individuals within the house that are going to be your main focus of interest? Is it the children, or is it the siblings of the children?
So I will focus on the children who are. I will focus on the children, like not on the siblings. Like first of all, there are not many siblings like in this cohort. Like at that time, the selective second child policy is just like being relaxed. So there are not many second child in this study. And also, the Chinese fertility rate is decreasing. Another part of another group of people I will focus on is the caregiver. I will see whether caregivers like parenting skills or parenting awareness have been improved.
The time impact, the time framework for the impact of the program, a year, 2 years?
It's one. I will show like 1 year impact and 2 year impact. But like there is a little bit more to it. I will show you a little bit later. So in this paper, I use the data from a cluster randomized control trial of a community-based early childhood development intervention in rural China. The sample consists of 100 rural villages, a parenting center, or like you can call it parenting playground, was built in 50 of them, like randomly assigned. And there are 2 cohorts within each villages, both in the control and in the treatment village. There are older cohort. They are the targeted, quote unquote, targeted cohort in this study. So they have access to the playground. Also, they get the psychosocial parenting training. I will explain what's the training a little bit later. And then the younger cohort is the focus of this paper. They only get access to the playground. I would say the meat of the intervention is the psychosocial parenting training, but younger cohort have access to the playground. They have access to the playground with older children, which is the older cohort, and also more experienced parents, which is the parents of the older cohort who get psychosocial parenting training. So I will show you what's the playground look like. It's usually like a room provided by the village committee, and then within the room, like the research team will decorate it to make it infant or child friendly with some jungle area, with some toys, with a soft carpet. And within the center, you can see like caregivers are looking at each other, trying to learn from, talking to each other. In this figure, like I would say this parents is actually observing the other caregiver, maybe trying to learn something from them. And also there are many children in the playground, they could look at each other and see, and maybe interact. Like sometimes when we are thinking about interaction, we believe it's like talking, but sometimes it's like for children, maybe they look at each other. This is also the way they interact, or they wave hands to each other.
So just to clarify, the one that didn't get the playground, do they got the training?
For the older cohort, yes, but for the younger cohort, they don't.
So no training for that. Okay.
For the younger cohort.
How old is the older cohort and the younger cohort?
Give me one second. I think. So the older cohort, they are 6 to 24 months old. For the younger cohort, they are at the beginning of the intervention. Many of them are still like it's not born yet. They're basically 1 year younger than the older cohort.
Can I ask you like where do the kids play before you build this room was built? I'm sure they must have been going out to play somewhere, right? Children in the village.
So I would say like this intervention changed the dynamics about like where children plays. Like I think usually like when children are very young, like parents do not dare to take them out of the home. Like one is for like because like it's all concrete road or like dirt road. Like it's very hard for children to. The children didn't even for younger cohort they cannot even stand. So it's impossible for them to play outside. But like with this soft carpet, like many parents, caregivers, they may bring children to the playground to play with each other. Usually, like before that, usually at home where they have the soft carpet.
Sorry. So when you say -6, that means that the mothers are in the playground.
Not necessarily. So they get access to the playground, but like mother may or may not attend the playground. They can go to the playground.
So pregnant mothers are eligible to come to the playground.
Yes, but like they are, but I don't think many of them have ever came. So one is that like after the second trimester, doctor usually disencourage them to. Especially Chinese doctor disencourage them to go outside. Yeah.
When you say mothers, you able to describe what they
Yes, I'm saying like so depends on the exact situation. Sometimes it's mom, sometimes it's grandma who take care of the children. But like for -6, they are in the mom's womb. Yeah. So let me show you the exact like timeline how this like -6 was actually defined. So at the beginning of the intervention, we have 6 to 24 months old babies, the older cohort. They are being enrolled, and then at 1 year follow up, we found the younger cohort. So at -6 to 6 months old, we didn't. We don't know who will be born, so we didn't even do a baseline survey for them. So we only found out who are those like -6 to 6 months younger cohort at the 1 year follow up of the older cohort, and then the younger cohort continue to receive the parenting training, continue to receive the intervention. After the 1 year follow up. At the 2 year follow up, I evaluate them. I got data of them, and then what I did here is to compare these two red dots to see whether the younger cohort benefited from this intervention more than the older cohort. But although this is suggestive because it's not taking place at the same time. But like conceptually, the younger cohort received 1 year of playground intervention, like let's call it playground intervention, and also another year of playground plus psychosocial parenting training. For the older cohort, they received 1 year of psychosocial parenting training plus the playground. So there are two differences between two cohorts. The younger cohort had access to the playground at very early stage of the life. And another thing is that when they have access to the playground, they are having access with a group of very experienced caregiver and also improved children as well.
But I thought why are the parents experienced when they're having it? They are not experienced. I thought they're only older cohorts parents are being treated, and you said there are no siblings. So how do they have experience?
So I think maybe it has something to do with my definition of experience. It's like they have more knowledge by receiving the intervention. So they know more about how to take care of the children, how to play with children.
But why? I thought they don't get. I thought you said the key distinction is in the first year of training, the younger cohort, children and parents only have access to the playground, but they have no psycho.
That's correct. That's correct. So they are having access to the playground with a group of experienced caregiver of the older cohort because they share the playground. The older cohort caregivers, they have more experience because of the intervention. Is this clear?
So basically, I think asking whether there's externality in terms of information spillover.
Yes, I will show a little bit evidence on that as well. So the review of results for the younger cohort, having intervention in the community, in the first year, they improved the language skill of children, and also it improved the parenting awareness of the caregiver. Those are all talking about the younger cohort. So I have like suggestive evidence about social interactions played a role. Children benefited more from the program when there are more similar age children at present in the village. Another is caregiver learn parenting practice from the other experienced older cohort caregiver.
I just want to ask, how do people enroll in this program? Like, do they go to the village chief or?
So in this study, the research team basically have the full list of all the households, and then we just talk to all the household like within the age has their children within the age eligibility, and all of them we survey them. Like we basically enroll it's a enroll of all the household in that village for both cohort.
So I mean, like a household of a younger cohort could say that they don't want to be included inside the treatment, or
so there are definitely cases that they decline to participate in the survey, and then we exclude them from the sample. That definitely exists, but like usually this doesn't happen too much.
So they are excluded from the playground.
They are excluded from the playground. I mean, in terms of actual practice, I don't know whether they are excluded from the playground, but like we never followed them, like surveyed them, so we don't know. Yeah. But yes, there are always like imperfect implementation. So with the continuous enrollment of the younger cohort receive an additional year of parenting training, the cumulative impact on the younger cohort is substantially larger than that on the initial target older cohort. So I think due to the time, I will skip the literature and contribution part. Like mostly it's like pure influence and indirect effect of social program. In this study, I would say there's a little bit nuance to it. Is that I wouldn't very clearly claim this is a spillover, because like playground is also kind of intervention. Like if we are talking about I could say maybe spillover of the parenting training component of the intervention, but like it's just too jargony. Like what I really want to say about this paper is that maybe it's very worthwhile to evaluate cohorts like after the target cohort, like so that each program could have long-lasting effect on the community, especially on the cohorts behind the initial target cohort. Go ahead.
Yeah, at some level, you would have to be able to kind of make this claim. I believe the design, which would have wanted is that the other cohort, which you now call the younger cohort, is exactly the same in age, so that we wash out these age effects. Because right now, the comparison between a old and a younger cohort, and to say the impacts are larger, it completely flies against how we started off saying, like, the earlier the intervention, the better. So is that the complementarity or the timing of the intervention? We can't just distinguish it out right now, yes?
I cannot.
Yeah.
Yeah, I agree. Like with a more cleaner design, yes. But like I think now I'm trying to offer some suggestive evidence. I don't want to make a strong statement either.
Sorry, are you, because I'm getting in the earlier part of the presentation, you mentioned about like, out of the 100, just 50 got the intervention, 50 don't. Are you also comparing not just the younger, older cohort, but also across the villages?
Yes.
So would that like help with the age effect?
But still, like it doesn't help with the age effect because, like, say, let me think about it. So, like, it could be like if we look at this figure, like, it could be like say additional year of the because like the younger cohort received the intervention much earlier than the older cohort. I mean, early in life in terms. Then like it could be a life effect, or it could be say 2 years of intervention is important.
But you're doing double difference, so like older, younger.
Yes.
Also older, younger, but in the control villages.
Yes.
So wouldn't you difference out the age effect in the control villages?
So like by comparing the younger cohort in the treatment and the control group, I get to know what's the impact of the 2-year effect. But like by doing the difference of the older cohort, I know the 1 year of the intervention. And then still like there are two components. There are still like two components that is different between the older and younger cohort. One is the intervention, the other is the timing of the intervention. Right.
I think the age is not so much, so the age effect is not really have so much impact because the timing is closer.
But I think like in the literature, people are always claiming the earlier the importance of early intervention is emphasized a lot. So like there are many reasons for this. Like it could be like the skill could be a skill, and then at the same time like there's complementarity in terms of the investment.
And you see a gradient when you just look within the younger cohort, right? Even there you have a time span, right?
Yes.
Ranging from -6 to 6. So that's the whole 12 months. If there are samples large enough, you go looking at within the younger cohort, does the treatment effect vary by age of starting, right?
Yes. Yes. So this is somewhat tricky in terms of like so although like say for the younger cohort, for the -6, those they don't have access to the playground because they are not born like in the first 6 months of the intervention. We don't necessarily know when they actually access the playground. So it's hard, and maybe the caregiver just learned those like information from other villagers like at the beginning of the intervention. Then like there's no difference in terms of exposure comparing them to those like maybe have children about 6 months old. So it's hard to use the age of the children as exposure to the intervention. So the remaining will consist of experiment design, data collection, empirical strategy, results, and conclusion. I do have information on parent use, but like the measurement is not so good. Like I only have like whether they attend the parenting playground, whether they ever use it. It's not like how many times.
How far are they away from the class?
I do have the distance, but like the distance, because the location of the playground is not exogenous. It's usually in the center of the city, so that location can be endogenous as well.
I think that I agree with it, and I think also that they are more likely to go as opposed to if a pregnant is on the playground, which is an extra cost for me.
Yes.
Yeah, so I think that is a variation in these about years.
Yes, I will take a look. Thanks. So background, another piece of background, the delay, the actual number of delay. So in the similar region of the study, 49% of children are cognitive delay, 52 are language delay. Like it's pretty, it's large enough that I kind of like disbelieve it, but like I think sometimes the actual number depends on the instrument that people use, the researcher use for the measurement.
And do we know anything in the literature from like people who are cognitively delayed, as we call them? Is it just that, because let's say even language development in young children, it's just a large variation, right? My daughter speaks, another kid who is 6 months older doesn't speak yet, but that kid is going to speak in a year's time, it's not like it's anyway going to affect the long run future,
I think like in terms of individual variation, I agree with you. But like say if the overall this is the aggregated number. So like if a whole community or a whole region is like speaking late, I'm worried. Like I think like there is also like if you speak late, I think definitely it has something to do. It has impact on your language development. It's like everybody can speak, but not everybody can speak very fluently or like understand language, the nuance of every sentence as well. So I think it's still important. So only a minority of the children engage in stimulating parenting activity. 14% of them tell stories to their children, and 50%. 50% caregivers do not do anything interactive, like in terms of playing with toys, singing to children, reading storybooks, and like tell stories. Those are measurement. So their lack of sufficient knowledge and resources on positive parenting practice. 55% of correctness on parenting knowledge. So in light of this, like the local branch of the China National Health Commission joined with REAPCE the Research Center at Stanford. Is where I did my postdoc. So they conduct a large scale cluster randomized control trial to evaluate early childhood development services. In each village, 2 cohorts are identified for different research agenda. As I said, targeted older cohort and non-targeted younger cohort.
So is there a reason why that was the design in terms of like why the younger cohort was not targeted for psychosocial training?
So that has something to do with the curriculum. The curriculum was adapted from the Jamaican Reach Up program, which only is applied to children from 6 to 36 months old. It's limited. The samples is limited to 24 months old because we want to leave 1 year of intervention for the oldest cohort, oldest children like within the 6 to 24 months range.
So if the curriculum is more designed and tailored for 6 to 24 months old, like how would we think about like the spillover effect from interaction with the parents, the older parents gets in that older cohort? Why would the younger cohort benefit from that?
So there are some like principles like being told like in the curriculum. So that's some part of it they might learn from. And also like for the children are younger from like -6 to 6, some of them will start to benefit from the content of the curriculum. For the oldest children in the younger cohort, they will start to benefit from the curriculum. So how exactly they benefit from the curriculum, that's something I cannot answer.
You have to use data on the parents. So for example, if you look at the parents,
So
what kind of jobs do they pull up ages?
I don't have a good measure of the time use, but like, I do have a little bit data on their parenting practice time, like in terms of their time invested in their children. So I will show you a little bit. There's improvement in impact on how long they play with their children. So I think I have covered this, but this is just review of some experiment design. It's 3 prefecture cities in the northwestern region of China. It's in the Shanxi province. If any of you know that province, it's like it's in the middle part of the China, but like China, the majority of development is on the coastal area, so that even in the middle part is considered an underdeveloped or developing area. So in the first year, in terms of the playground and parenting training, I will want to provide a little bit more information. So each treatment village indoor playground was built by the research team using this space provided by local villages. Playground is designed to open 5 hours a day and 6 days a week. On average, they open 275 days during a year. Excluding some national vacations, I think is for, I would say like they open about like say 90% or like 85% of the design days, and then parents are not allowed to leave their children alone in the playground. So this is kind of key to the key information. So this is not a daycare.
5 hours means any time of the day?
What's that?
5 hours means any time of the day.
So it's the time will be determined by the manager hired by the research team. They discuss the time with the local villagers. It's usually say 9 or 10 a.m. to 3 to 4 p.m. in the day.
Mornings.
Well,
So I think in the earlier part of the presentation, you showed the picture of a mother with a kid on her back. So thinking about this intervention, which is like this is an opportunity care and that's happening there as well. So who are the mothers who are going to be targeted by this program, and what are their like alternative activities if they were not here in the playground?
Yeah, so I think it's a very interesting research to see like who participated the actual intervention. It's not part of the story in this paper, but I think I should explore it. Yeah, this paper is more about you evaluate the overall impact. Go ahead.
How many parents and children were
How many parents, like in terms of like, also in general, I think I have. So it's like in each village there are about 10 households. So it's in total it's like I think it's like about like 1,050. So in the baseline survey, the younger cohort were not surveyed. 1 year follow-up, 1,050 were surveyed, and 7-year follow-up, 880 were surveyed.
Can you speak more on to the sample and depth into the sample as to like if I imagine like if there's a center, you might be able to target people or parents who are in the center. intention of participating in the center. But then for control areas, like who are your, I guess.
So like for both treatment and control, like it's not by so you submit application and I enroll you. It's like I have a list of all the household in the village, and then I start to talk to those households. Unless you decline me, otherwise you will be enrolled.
For the parents of the experience, because the caregiver voluntarily tell you how much they spend this time, or does the enumerator come?
It's self-report. Like
So
I wish it's like
it
offered.
could be a revenue back, right?
Yes.
Speaking of I'm thinking about, or actually, do they switch caregivers? Because I assume these are villages and a lot of women are always the same. Yeah, just wondering about the proportion of maybe electrician in terms of caregiver.
So the when they switch caregiver and then we still find them, that's not part of attrition. But like I think there are definitely more moms going out like after the children gets older. So I don't know what the exact number, but like I think there are about like maybe 10 to 20%. Like initially it's like 50% mother, 50% grandma, and then by the 1 year mark, probably 70% grandma and 30% mom. Yes.
And this area that you are covering, what is the mother tongue of all the people Mandarin here, or what do the people speak?
Those are all Han people, like Mandarin, speaking Mandarin, and also the curriculum at this time at this time is still only only for the Han Mandarin speaking people, like because like there are lots. Like if we want to adapt it to the minorities, like there are lots of culture practice needs to be considered, which is a lot of work at this time. So the research.
All these villages are Han population.
Yes.
I'm just thinking, this 24 months bracket, the kind of language, can you understand what you're saying? How the children to track their language. So how do you determine that they are speaking?
Okay, so this is like has something to do with the Bailey scale, like we measured it. So it's not like the Bailey scale is like observed by the enumerator. So basically, what we do is to play games. Like we have a box of like toys, and then we play a specific game according to the instruments. And if the children can complete it, then they get 1 score. And then if they cannot, they don't. And then the enumerator are trained to listen to the conversation with the caregiver and children. And then from the moment they enter the household to they finish the test, how many words being spoken by the children, and also like what kind of words being spoken by the children. Those are things that used to measure the language development. We have information on the child development, parental time investment, and parenting awareness, which is like assessed by asking caregiver a serious question on parenting knowledge and confidence.
So you didn't track the caregiver coming to the playground?
I only have data, very poorly measured data on whether they ever come to the parenting center for the younger cohort. For the older cohort, yes, very detailed information. I don't have the baseline data, but how do I did the balance test? It's just I used the demographic information on the younger cohort to see in the control village and treatment village whether they are different. So they are mostly balanced except for like the housing value, a few categories in housing value, and I include them in the regression.
The control villages were richer.
Slightly. So like for one category they are poor, and for one category they are richer. So it's not. to me, it's not a say big deal, like in terms of imbalance.
Parental investment from the mother or from both parents?
For anyone who is taking care of the children, it can be mom and can be grandma. Like who we will identify in the survey. We basically survey who is the primary caregivers that can invest in. So it leaves me very little bit, like I only have 15 minutes to present results, so I will be quick. So in terms of empirical specification is very straightforward. The treatment assignment is the main, the coefficient from treatment assignment is the main variable, main coefficient of interest, and then control for some covariates, and then Y is child development, parental time investment, parenting awareness.
Sorry to interrupt, that's another one. Okay, so now you're not showing us the things for the older cohort because that's another paper.
That's another paper, yes. But I will use a little bit older cohort data, like in the exploring.
And you do observe economically significant effects for the older cohort for this program.
More positive impact on the child development. Yes.
Okay.
Yes. So impact in terms of child development, cognitive. We have measure of cognitive skill, language skill, and motor skills, and then it's only showing up in the receptive language skills, and then it's driving the overall language skills a little bit towards positive, and also so like the overall language skill is a combination of receptive and expressive language skills, not so much on the fine motor or like cognitive skills. And I have one slide on compliance. So ever went to the playground? So like 60% of them ever went to the playground. And in terms of the parental time investment, I don't see much other measurements, only time playing with the children, maybe providing this, the playground gives them a place to play with children.
Do you have a treatment on the treated estimates?
So this is somewhat tricky to use treatment on the treated estimate. So thinking about like say this treatment assignment could enter the intervention, could enter the second stage in terms of like say if the treatment improve others others parenting skill, and then others parenting skill can also affect your child development. So that's why I'm not showing the treatment on the treated. That's something will always happen to a like cluster randomized control trial like this. We need to take care, be very patient, very careful on when to use treatment on the treated.
Any explanation why the coefficient is bigger?
So basically it's like to me the interpretation is that providing this playground actually give a place for the children, for the caregiver to play with children, so that is significant. It's 20 minutes more. It's not like much more actually.
So what is the literacy rate around the literacy rate? Because one of the Americans historical.
That's a good question. Yes.
Universal law.
What's that?
So it must be universal law in China. Most data institutes are there.
I think for mom, they must be able to know like how to read, but like grandmas, I'm not so sure. So I need to probably double check.
I think the time plane needs more information.
What's
Because
that?
the time plane for the coefficient to be bigger. One possible reason I'm just suspecting could be the measurement.
Yeah, it could be a measurement issue, but like it, yeah. But like say, but like
It's consistently.
so another thing like on parenting awareness, like I do see kind of overall improvement in their like awareness, parenting awareness. Like they know how playing is important, know how to play, and then know how to read, and also I generate an index like for these measures. Like,
And you do something for these parental awareness questions with a self-reporter to deal with the
self-
disability aspects of it, because after running this program, interviewing them, people are bound to say, yeah, of course, I think it's important to know all these things, no?
yeah, this is also a caveat in terms of the measurements. This is self-reported. Like, it's very hard to kind of having those information by observing them.
Like student try to incorporate something like Seema Chandra and all do the paper to measure desirability bias at the beginning of the survey, and then to look at treatment effects by how they vary by social desirability levels of individuals.
In this data set, no, but like I'm eager to apply some of them in the future studies. Yes. So one of the key component or key mechanism in our mind is like probably this like social interactions in the village could play a role. So what we did is to suggestively trying to pin it suggestively. So what we did is to do a treatment heterogeneity by number of cohort, number of household between like from older cohort and younger cohort to see whether there is treatment heterogeneity. Those numbers are demeaned so that we can see that the overall impact is in the similar magnitude as what I show you in the overall treatment effect. So what we see is that when there are more younger cohort in this village, the impact is better for the younger cohort development.
And how big are these coefficients? How should I interpret them?
So it's like one more younger cohort in the village, your language development will be improved by 0.04 standard deviation. It's not a small magnitude.
So I'm not sure why the younger cohort size would offer this idea of social learning. Is it more, because I guess like if it's more about social interactions, what matters more is the age of the parents, the age of the children.
So like say, it could have something to do with like, so I think maybe I think to be more careful, I should say that when there are more similar age children household in the village, the impact will be higher. It doesn't necessarily imply that it's children learning, interacting with children. It could be like their caregiver are interacting, so that, but like I cannot distinguish that. So it could be like say if I have children similar to yours, and then I will talk to you more to get your experience, to learn from you. But like at the same time, it could be like similar age children, like they find it more interacting, playing with a similar age counterpart, so that they get more exposure.
So a non-positive story is that if you have more diversity in the village group, right, then you might have more spillovers. If we think about the literature from like education, like if you're exposed to more diverse groups, then there's more learning. I don't know whether that's true here as well.
First of all, I don't know how to measure diversity in this village, in those
Maybe
villages.
the age of the parents and grandparents, younger woman going and then see like older woman and then learn from there.
Yes.
So it could not be like they only learning from the program. Maybe they are also learning from the other person older in the playground.
Yes. Yeah, maybe I can run some heterogeneity if I can find a good measurement of diversity. Yes.
Excuse me, I'm wondering why, how actually you measure the cognitive skills?
What's
Cognitive.
cognitive skills. So it's like playing games with them to see whether they score like whether they can complete a play test.
Finish it.
Am I allowed to like extend?
Like
5 minutes?
Yeah.
Okay, yeah, that would be awesome. So, and also I have some suggested evidence that social learning from other knowledgeable or experienced caregiver, when there are more older cohort households, their parenting awareness will be improved. But like the two things are not aligned. So that's something I was a little bit confused, and then I don't know, like say how to put them together to make a stronger result. But that's what I found. Like, and I did many robustness check because this is treatment heterogeneity. Like those like cohort size could be correlated with other village covariates, and those could play a role like in terms of treatment effect. So that I include treatment interactions of treatment and other village covariates in the regression, and it doesn't change the results much. So, and also I found that there are more interactions like children playing with children. So like this is like the age of the children at the 1 year follow-up. This is exactly the group of the younger cohort group. So they are -6 to 6 at the beginning of intervention. At the 1 year mark, they are 6 to 18. So an overall number of children they are playing with. And I also have some very preliminary like heterogeneity by network measures. So a pity is that I don't have the network information about the younger, but I do have the information about the network information about the older cohort. So what I did is to use a neural network model. Basically, I have a group of information that had a group of samples that has information on network, and then I use them to train a model to predict whether other households are connected using the SES information. But I would say this is very problematic because according to the networking literature, it's usually that those unobservables that determine whether you and me are friends. So very preliminary. So what I did, what I have, but 88% of the correctness rate, I would say it's not enough. But like I have some results say if you have more predicted connected predicted friends in the younger cohort, the impact is like the overall sign is like very similar to what I just showed you. And also centrality doesn't play a role, like whether you're important in the village doesn't play a role. And whether the village is somewhat close-knit is important in this setting. But those are very suggestive. So another thing I did is to try to pin whether caregiver are really learning from the older caregiver. So what I did is to use this partial design in terms of the parenting training. So for the older cohort, they get parenting training, and younger cohort they didn't. So for if we model them in terms of their parenting awareness in terms of this linear immense model, then for the older cohort, they are getting a treatment impact. For the younger cohorts, they don't. And then if I combine these two equations into a village equation, you will see the village average is impacted by the treatment assignments. But for the younger cohort, the treatment assignment does not enter their equation directly. This offer an IB idea is that the village, the overall village parenting awareness is affected by the treatment assignment. But treatment assignment does not directly affect younger cohorts' parenting awareness. So using this IV strategy, we can, what I found is that village mean of parenting awareness strongly affect the younger cohorts' parenting awareness. So this is somewhat evidence I offer on their learning from other peer group. And then the last thing evidence I want to show you is to see suggested evidence on additional year of playground, how much difference it's making for the younger cohort. The cohort 2 is a younger cohort. Cohort 1 is the older cohort. So in terms of cognitive development, both of them are improved, but like the difference is not significant. But what's key here is the language development. It's almost 0 for the younger cohort, and it's much more, and also the difference is significant for the younger cohort. So it has some. I don't know like what's like exactly story behind it. It could be like say early exposure to somewhat service like this can benefit them like in terms of language development. So in terms of the overall parenting awareness, there are not much difference. Like say they could digest the information provided by the curriculum as well. Like, so let me conclude. So ECD intervention could have impact in the house on the household in the community, no matter whether targeted by the program. Having program in the community improves the language development of the non-targeted younger cohort, and there are suggestive evidence on social interaction and early start play a role in ECD. Results could contribute to policy discussion about how to effectively, I would say, deliver ECD intervention, but also evaluate ECD intervention. So that's the point I raised. Like if say a program affecting the village for many more cohorts down the road, how do we factor those information into like policy making? Yeah, that's it. Thank you.
Thank you very much. We are already over time, so we're gonna conclude now. But there is coffee and some snacks outside, so feel free to keep the conversation going. And thank you very much for coming, and see you next week. We're gonna have Professor Theo from Nottingham University. So thank you very much, and see you next week.
Thank you.